Welcome back, everybody. Let me ask you this. If you had symptoms of kidney disease, would you even know it? Well, most people would not. And that's why the office of Crystal Peoples-Stokes is working with the Western New York Kidney Foundation on a free health screening for that disease. Now, Kevin Jolly is here from the Majority Leader's office, along with Barbara Breckenridge from the foundation. We're so glad that you're here to tell us about this, because this is a completely free screening. Barbara, what do we know about kidney disease?
Well, first of all, 1 in 7 people in Western New York has some form of kidney disease, and most of them are unaware because most times there are no symptoms until the later stages. So we have these screenings to try and identify people in the early stages so as maybe to slow the progression or sometimes even stop it.
What might be some of the risk factors for this?
High blood pressure, diabetes are the leading causes. You know, people over 65, African American, Native American, Hispanics are more prevalent. You know, it's the whole spectrum. We see a lot of older people now having to go on dialysis because people are living longer.
Yeah.
And with all the medications and that, they just wear out, you know. So, but we see a lot of young people too with uncontrolled high blood pressure and diabetes are the leading causes.
Is there also a genetic risk? If you had it in the family, grandparents, parents, you might be at higher risk?
Absolutely, yeah. Yes. That's one of the symptoms, not one of the symptoms, one of the issues too. If your family member, mother, father, grandmother, grandparents, if it's in your family tree, high blood pressure, diabetes, or even kidney disease,
all right,
you're at great risk.
And I wanted to add to this as well. Sure. While kidney disease certainly doesn't discriminate, there is a racial disparity with kidney disease. For instance, black and African Americans suffer from kidney disease at a significantly higher rate than Caucasians. It was 3 times higher, which is incredible. This is why we want to get the word out to everyone. African Americans constitute more than 35% of all patients in the U.S. who are receiving dialysis. Crystal Peoples-Stokes, the Majority Leader, is very passionate about this issue because her daughter is very public about this. Her daughter had a kidney transplant. She's doing very well, but again, it shows you that it can impact anyone. Her mom is healthy, 95 years old, very healthy. Crystal is very healthy, but her daughter had a kidney transplant. So it can certainly affect anyone, and we want people to come out and get this screening, because there are some factors that can only be detected if you have your kidney screened.
And it's a very comprehensive screening.
Yes, tell us about that.
Yes, well, we have 6 stages that they will go through. They come in, they register. After they register, they have to fill out a small health assessment. Then they go and get the blood pressure done, their weight, body mass index. After that, they get the glucose testing, the blood pressure, and after that, we always have a medical professional on site, doctor or PA, that will go over those results with them. We don't do any diagnosis, but we just let them know that they are at risk because the blood pressure is high or the glucose is high, or there might be protein in the urine. We do a urine test too. That really shows, could be an early indication of kidney disease.
All right, if you've never been tested for kidney disease, remember this is absolutely free. This is happening March 14th at the Schiller Park Senior Center. Consider yourself invited, 10 to 1 p.m., and everyone will leave that with information, all right? So there you go, everybody, please. Or you can give a call to Crystal Peoples-Stokes' office, but here it is, 10 to 1 Saturday, March 14th, Schiller Park Senior Center, right on Genesee Street in Buffalo. Give them a call, and you can even email Barbara at barbara@kfwny.org, and go get yourself tested for your good health.